Good evening to all the viewers who are watching live and is watching on a recorded version. Let me just tell you this that we are having exam issues. We are having our exam. For that, the IT team members, are unable to cope up with the IT works. So please pardon us with that, like issuation of the certificate, CME certificate, then issuation, and then about the quiz competition, and then again with the Spotify thing which we have done, the Spotify playlist updation. We have promised to upload I mean highlights on every week, on every Sundays, but we are failing to do so due to our exam high alert on examination. So please pardon us with that, and rest we will talk at the end. So we have wasted 6 minutes, and now without wasting any more time, let's just start today's CME with the 30 seconds countdown time.
Good evening, sir, and good evening to entire homeopathic
Good
fraternity.
evening. Very good evening.
Starting from few years ago, now we are on the 56th episode of our online continued medical education program. And all thank goes to all the alumni who are being participant in this and helping our beloved President Kalyani sir, through his motivation, the inspirer Dr. Aishwarya Dash, whose brainchild was this CME, and with our young fourth future doctors in the IT team with Orko Mukherjee. So, with permission of our President Kalyani sir,
Sure,
can
let
I
us start.
call on the inaugurator tonight?
Definitely call him, please.
Thank you, sir. And our inaugurator tonight is Dr. T. Bendangtula Zamir, and she is the Deputy Director AYUSH from Government of Nagaland, sorry, Mizoram. And before I'll request Orko to bring her on the screen, but we have a very exciting announcement to do. As you all know that our alumni meet is coming, and we'll be meeting again offline, face to face, on 9th of December. The venue is will be Kolkata. The perfect place will be decided after we meet our director, sir, very shortly in the coming week, and we'll finalize the venue and we'll let you know all. Now, welcome in the CME, our inaugurator tonight, Dr. Bendangtula. Over to you. The screen is all yours.
Hello, good evening to the 56th CME of NIH Alumni Association. A little correction, I'm from Nagaland. So, greetings to all from the beautiful hills of Nagaland. Over here comes September and you start getting the wintry feelings. So that's where I am, up here in the hills from Kohima. Well, this first of all, I just take this privilege with great joy to be the inaugurator of the CME this evening. And my sincere thanks and gratitude goes to Dr. Bidyut Mukherjee, whom we very fondly call as Bidyutta, for inviting me, and also to Dr. Kalyan sir. Well, this CME is a very good platform, I feel, for everybody to come together, not just to update our knowledge on the latest happenings in our profession, but also to get connected with our old teachers, seniors, friends, and establish a good network and where we can collaborate in future. As we all know, this networking is a very powerful tool in today's world, and a lot of accomplishment can be achieved if we are connected with the right person. And tonight, I couldn't just help but look back over the years that's gone by and relive our NIH days again in the 90s. Well, I'm from the fourth batch, so that's quite some time back. And the Bituta and all were our senior most datas, and we spend our days there. And um, back then, if we think about it, NIH was in sort of a formative initial period. So a lot of the facilities that you see today, they were not there, and we did had our shares of challenges. But I can say that those were just beautiful years that we spent. We had excellent teachers who invested so much in our life. We had seniors who really encouraged us and who were our friends. And, they even used to give us tuitions during the free time. So I can say that what we are today, it's because, during the course of our journey, we came across this wonderful people, teachers, seniors, friends. And I can proudly say that, it's so great. It feels great to be a part of alumni, NIH. And yes, I would say that we're living in a very exciting time, because in today's world, the medical world is coming to understand that a single patty or a remedy is unable to tackle all the ailments which mankind is facing. So there's so much of a shift in embracing the complementary alternative systems of medicine, where people are valuing it, looking to it. And I think that Ayush has got a lot of role to play here. And our country, India, is playing a very crucial part. So just a small encouragement here, we are in this scenario, we as a Ayush professional has so much to contribute. And I would just encourage that as a homeopath, how are we contributing to the society? I think that's a very important thing that we can think about, ponder upon. And tonight, the CMEs that are lined up is so interesting. We have all this wonderful topic, like the medical coding and career opportunity. Those were terms we didn't get to hear much about during our times, but that just shows how much is advancing in how much of technology it's advancing even in our system. And let us find things, every day you come across so much of developments and findings and innovations which are all scientifically backed even in our system. So it's a great privilege, I can say confidently, to be a part of this profession. So coming back to our topic, the medical coding and career opportunities, Dr. Prasanna Bera, who is a guest faculty from Backson Homoeopathic Medical College. He'll be bringing that topic. Then the other one. So there we'll get to learn about, the translation of medical reports into, efficient coding data and all that. And also the understanding fatty liver and its homeopathic management by Dr. Amit Pandey, HOD Homeopathic Department, Vivekananda Polyclinic and Institute of Medical Sciences in Lucknow. And then we have the moderator, Dr. Rajan Kumar Tosh, Professor in HOD, Department of Physiology, Biochemistry, Metropolitan Homeopathic Medical College and Hospital. So all these interesting topics will be brought by very prominent, eminent teachers. And tonight, I think we're so fortunate for those of us who are locked in tonight to the CME will have a very fruitful and a productive time. So with this, I will just hand over the time to our moderator. Thank you.
Good evening, everybody, and welcome to online CME 56 by NIH Alumni Association. And we're starting a good topics. Number one, first, medical coding and career opportunities by Dr. Prasanna Bera, and he is a guest faculty of Backson Homeopathic Medical College. And the second topic is understanding fatty liver disease and its homeopathic management by Dr. Amit Pandey, who is a HOD, Homeopathic Department of Vivekanand Polyclinic and Institutes of Medical Sciences, Lucknow. And it's a very, very good topics nowadays by which we can career our opportunities. First of all, I call Dr. Prasanna Bera to start his topics, that is medical coding and opportunities. So I just call Dr. Prasanna Bera just to start the seminar and without losing our any time. Okay, thank you. Starts.
Thank you so much. Thank you. Good evening, everyone. So, this is Dr. Prasanna. Uh, I graduated BHMS from Midnapur Homeopathic College in 1999. So, it's almost 23 years of experience in this domain. And I joined NIH as in the MD program of fourth batch PGT. And in those days, there was only single entrance, and I stood third in that entrance. And in that batch, we only 5 qualified. So there was only 5 PGT in that particular batch, fourth batch. So that was a very nice exposure. We got it in NIH with so many stalwarts, faculty. Also, we are fortunate to get very few very nice seniors. One of them was Dr. Siddhesar Mondal, who introduced me to Dr. S.P. De, Surjapada De. So I was very fortunate and enlightened by Dr. S.P. De. So as my topic is not a core subject of homeopathy, nothing to do with homeopathy. So that's why. Okay. So I hope I wanted to start a few little bit of homeopathy in this. I wanted to share a few books of Dr. S.P. De. Why I'm saying? Because in those days, Dr. S.P. De's lectures was available in cassettes. You know, cassettes, audio cassettes. Those are old form of audio cassette. They used to get damaged, etc. So I converted that in digital format and tried to publish and published a CD, Dr. S.P. De's lectures, which are invaluable contribution of Dr. S.P. De's. So I would advise people who are going to practice homeopathy seriously should listen those lectures. The second thing, I want to just show some books of Dr. S.P. De. So we all know this book, The Essentials of Principles of Practice of Homeopathy. I'm taking this opportunity to emphasize the importance of these books. This is a very important book of clinical case reports on constitutional prescribing. It says constitution, but it actually gives 46 cases of prescription covering the miasmatic background. People who are really interested in theory of chronic disease, they should take help of this, where he has given very nice demonstration of how to prescribe miasmatically. The third book is the nosodes, clinical experience with some nosodes. An excellent, one of the best book on nosodes what I have. And another books I just want to share, because I find these books pretty interesting, and these are some original works. This is one of my senior student of Dr. S.P. De, Dr. Dilip Bhattacharya. I find his books very original. What I mean, it's not a copying pasting from here and collecting works. It is a serious type of original work with homeopathy through the spectacles of psychiatry. People who are interested in psychiatry and its incorporation with Hahnemannian principle, with organ of medicine and theory of chronic disease. This is quite a serious attempt. So here's another book, Unveiling Some Secrets of Homeopathy, The Unknown in the Known, and the other books are in Bangla, people Bengali, Notunalaya Homeopathy, and this one is Homeopathy Jana Ho Jana. Unfortunately, these books are all available in only Kolkata, not in other places. I think so. But if someone is interested, I stay in Greater Noida. So in North India or in Delhi NCR, people can contact me. I just took this opportunity to highlight these things because I thought that was quite helpful for others. So now let me focus on the topic, the core topic. Actually, after completing the MD, I joined in the different colleges as faculty, as a lecturer in Gujarat, like Ahmedabad, Bhavnagar, and Gwalior. But unfortunately, the the financial status or remuneration is such a meager. I mean, there is a huge gap between the private college financials and salaries, etc., with the government colleges. Huge bag. Still, there is a huge gap, disparity. So I couldn't survive economically in that condition. So I switched over to this career. This is a serious sort of career opportunities, especially for newbies. And to say that four of my NIH alumni is still working with me. And when I joined this company in 2009, the first person who was my under whom I was working, he was also from NIHMD, the fifth batch, Sanjog, from Gurgaon. So let's start with. So can I scroll down like this? How can I move the slides? Okay, just thank you.
Sir, by
Yes, yes, yes.
by the keyboard.
Got it, got it, got it. So this is entirely of a concept of business outsourcing. So what happens that in United States, when they are hiring a person to do a job, they pay them in dollar. Now, if you are paying a person say $1,000, and in that $1,000 you can hire 4 or 5 people in India. So that saves a lot of money, and that's the concept of knowledge process outsourcing. There's a huge opportunity growing here. I mean, we all know the IT revolution which has happened in India, and there's a huge revenue we are collecting from this. It's a $40 billion industry. So let me go through. I'm just giving the basics. It's nothing but only the basics. So what happened in United States? We are focusing only on United States healthcare system. So as an insurance company, the customer purchase a plan or a policy. Now they, when go to any doctor, the doctor is called your provider. It can be anyone of any specialty, cardiologist, neurologist, whatever. So they give certain services. It can be a simple injections from minor surgery to a major surgery. So whatever the service he has rendered, he document them in a medical record, and that goes to the coder. So a coder who's trained in converting those documents, the language, into a particular specific code. So he selects code, and then those codes goes to the provider. They are submitted to the insurance company for reimbursement. Actually, I work in a company as a fraud expert. Why? Because there's huge fraud goes on. It's a $1 trillion fraud industry, only a fraud industry. So what happens? There are different type of frauds. I'm not going to discuss in detail. Just I'm giving the basics. So medical code actually translates the documentation into standardized codes that tell payers the following: the patient's diagnosis, medical necessity of treatment, treatment services, supplies provided to the patient, any unusual circumstances which has changed the scenario, which is covered by modifiers. So the coding is translation of medical reports into code used within the healthcare industry. This helps summarize otherwise cumbersome medical reports. So actually what happens, there are 100 different types of diagnosis, so many different types of surgery, and also evolution surgery, the evolving surgery. There are many evolving areas. So new techniques are coming, new diagnostics are coming. So new methods are coming for services and diagnosis. The coders reviews the medical record and assign numeric codes to each diagnosis, procedure, and service documented. The diagnosis and procedure codes are taken from medical record, such as transcription. Medical coders are individuals responsible for translating physician's report into codes. So here is the challenge. And what I want to say, it's a huge ocean of knowledge and ocean of so many specialty among coding. So there are inpatient, outpatient, so many others, domain, other departments. I'm just giving a brief only. So you can understand already that there can be 100 different types of specialty. Medical coding classifies these for easier reporting and tracking. And in healthcare, there are multiple descriptions, acronyms, synonyms, names, eponyms, names for each disease, procedure, and tool. Medical coding standardizes the language and presentation of all these elements so they can be more easily understood and managed. Most important is managed. So provide, this is what, why it is done. The actual importance is data. This is the century of data. Everywhere you go, we need the data mining, artificial intelligence, machine learning, everything is governed by data. The economics, whole governance, banking system, economic system, everything is governed by data. So if I can convert those languages into data, I can manage a huge gold mine. That's a gold mine. Data is a gold mine. Provide a statistical database, serve as an information retrieval system, facilitate payment, evaluate utilization pattern, study health cost, which is a very important aspect. Financial aspect cannot be ignored. Everything is involved with the financial costs. Research and quality, predict healthcare trends. Epidemiology, we all know that. If you see the PSM book, is governed by data. Where it is done in hospital, physician's office, everywhere, wherever the possible places where the medicine is contacted. Now, the characteristics, I mean, these are minimum requirements. I mean, you need a little basic knowledge of medical terminology, the basics knowledge of anatomy, physiology, pathology, etc. Detail oriented, we have to be detail oriented and accurate, because there are multiple similar codes, so we need to be very precise on which code to select. There are a lot of critical thinking, because code description, we have to match the medical record with the code description, and for that we need to do a lot of research work. Willingness to learn, that's everywhere you need. So this is coder's responsibility. Assess the documentation with completeness and clarity. Determine the provider, patient type, place and payer. Abstract the diagnosis and procedures. Assign accurate and complete codes. Verify the codes, they are compliant or not non-compliant. Why? Because of the evolution and evolving technology, many methods are getting obsolete. So some of the codes get deleted and new technologies come up and new codes are coming every year. So the golden rule is that read the report from top to bottom, not document, not done. So we are not supposed to guess anything. If it is not document, we are not going to supposed to consider it. So what happens actually after medical provider, the doctor examines and treats a patient, the insurance company needs to understand what was done in order to process the bill. That is the financial submission. Common language is inexact to give the insurance company the accurate details it needs. So a set of specific code has been established to define medical procedures. So while complex and detail-driven medical coding really comes down to knowing how to navigate the three main codes. So these are three main codes: CPT, HCPC, and ICD. So what is CPT? What we work in this, our organization about the fraud, so mostly we are focused on the procedural coding, not in diagnosis coding. CPT full form is Current Procedural Terminology, developed and maintained by American Medical Association, AMA. This is a huge body which governs everything. and they also govern the CPD coding. Now you can understand the criticality of coding, medical coding. So you can say that whole US healthcare industry is dependent on coding. Until unless anything is coded, you cannot submit your bill. So that's the criticality of coding. Updated in 1st January every year. These are 5-digit or alphanumeric codes representing procedures or services performed. Procedures, an example is simple injection. For example, take an injection, a person is given injection in the knee joint. So the code will be 20610. Now, if in any case he is using ultrasound guidance, I mean he is giving injection with the help of ultrasound guidance, the code will be 20611. Another is the other code. You can see the description: collagen linking of cornea, including removal of epithelium, tachymetry, etc. Let me give a very simple example. Here you will have an idea of one simple procedure called appendicectomy. There can be a different scenario, different methods of appendicectomy. 44900, where we see incision and drainage of appendiceal abscess. Open means you know that there is two types, open and laparoscopic procedures. 44950 is appendicectomy. 44955 is when appendicectomy is done at the time of doing another major procedure. And 960 is appendicectomy when it is ruptured appendix with generalized peritonitis. And of course, we have different code for laparoscopic procedures. So laparoscopy and open have different codes. And if the surgeon is doing something else than what the code we have, then he will do code 44979, which is called unlisted. So new or unusual procedures of appendix that do not have any assigned code. So this particular slide gives an idea that the job of coder is not easy. You need to be very precise in your assigning code by reading the surgical note very, very carefully, because what exactly happened, that has to be considered while selecting the code. ICD, we are not interested in ICD, but although this is also, there are a lot of jobs in ICD coding also, but they don't follow. In USA, as you all know, they don't follow the ICD 10. They modify it in their own way, like they do it clinical modification, ICD 10 CM. ICD 11 is also coming in future. And for example, in the psychiatry, they have a separate type of classification, a DSM, Diagnostic and Statistical Manual, DSM 5. So they don't follow what the world follows, because the world follows WHO, but they have a different type of classifications. This is another type of codes, HCPCS, Healthcare Common Procedures Coding System, published by CMS. CMS is another very important organization of Government of United States, Center for Medicare and Medicaid Services. Updated 1st of January every year, and 5-digit alphanumeric codes representing medical supplies, durable medical equipment. Example, you can say like crutches, like wheelchairs, ambulance services, prosthetics, orthotics, and the drugs, injectable drugs, not the oral drugs. Injectable drugs have the code. One example is J3301, which is for Kenalog 40 injection. So if he's done this injection, he will bill J3301, which is a triamcinolone acetonide. Now, I'm just quickly giving you the brief opportunities, as we have seen in IT industry, IT revolution. It is all based on the offshoring business. Since India is a preferred destination of offshoring, one of the major destination in the world, from not only from USA but from several countries, developed countries, they offshore the jobs, and there are huge offshoring business in medical coding and billing also. It is one of the most demanding career perspective right now in India. Healthcare offshoring industry is growing like anything. India is known to be second largest healthcare outsourcing destination. Nearly 80% of the healthcare business from US is outsourced to India. Thus, the demand of professional medical coders is increasing, and they play a crucial role in healthcare delivery system, as quite uh, understandable that the coders are important cog in the wheel. That's a very important. They play a very important role in the whole healthcare system. The need and demand of coding will only keep rising since the recent advance of computer assisted coding. There are new avenues of codes, new type of machine learning, everything happening, artificial intelligence, and everything is happening here. But still, the job of coder will be there, and there will be growth only. There is a certification program, there is an exam conducted in India. This exam is conducted in India itself. So Indian citizen can appear in this exam and can be a certified coder. So certified professional coder, CPC, it is conducted by CPC, credential demonstrate expertise in coding medical services and procedures performed by physicians. So it's done by AAPC, American Academy of Professional Coders. They offer online exams, and these are the charges. I don't know is the latest one or not, but roughly around this $500 like that. I think it's now $500. The demand and supply gap for certified medical coders is approximately 40% and has increased significantly over the last year. The field of medical coding is growing at much faster rate than average, and the employment of medical coders projected to grow 15% just like this. So what I want to say that in 2009 I joined in this company that's called United Healthcare, which is a Fortune 500 company, fifth rank. I mean, you have those Walmart, Apple, and our company is fifth. So far stability is concerned, now people are doubtful about the private corporate jobs. The stability is concerned, we are immune to recession, COVID. In the COVID years, we made, actually our revenue grew. Why? Because people were not going to hospitals to take their regular or elected surgery, etc. So our revenue actually grew on those years. And economic recession or inflation, we are immune to that. In 2009 when I joined, there was a huge recession in United States itself, but nothing happened here in my domain. And it's increasing day by day. We have our offices in Gurgaon, Noida. I'm working in Noida, and I'm a training consultant here. And we have it in Hyderabad also. But so far medical coding, I mean core coding job is concerned, there are good jobs in Navi Mumbai. Hyderabad is a very important point. Bangalore, Chennai, and of course the Delhi NCR. I don't have much knowledge about Kolkata because I think Kolkata is lagging behind in these new things. I don't know about Kolkata, but in here we have other places, other cities, we have a lot of opportunities. People can consider this as a serious career opportunities. I do also practice homeopathy. I have my own clinic in weekdays, weekends, and I am also the faculty of guest faculty in Backson Homeopathic College. I take class in UG and also in MD, post graduation. What we do, I am not a certified coder. This is the last slide. Okay, I am not a certified coder, but even a non-coder can do this job. So what actually happens in even United States, the nurses are trained in that. Mainly the nurses go into this, so they have a lot of clinical experience and a lot of knowledge and training, actual practical training, plus this coding knowledge. They get a very good salary, very good, excellent. And some of my colleagues is already they were working with me in India, and now they are in migrate to United States. So they have a very good career there, and they are some of them were homeopath. I mean, BHMS from Nehru Homeopathy, Delhi. Anyway, here we don't hire MBBS. Other than MBBS, we hire everyone, but it's only available in Gurgaon, Noida, and Hyderabad. But other than that, as a simple coding job, the jobs are there in all parts of India. And I think I have covered the basics. These are the simple basics, different types of codes. This slide gives a good idea, a good overview of what we are actually looking into, the CPT codes. And this is very scientific approach of keeping all the data. In India, I don't think CPT coding is in much of use. We are actually using the ICD codings, but in this way we can standardize our cost also. That is a very important issue in India nowadays. In private hospitals, you cannot just judge the, I mean, in private hospital the cost of billing is huge. Until unless you have a cover, insurance cover, you are in big trouble. But if you can standardize this thing, the cost effectiveness, the government of India should do very serious thinking in this. They should do some regulation to cut down the cost, and some regularity, some scientific approach. One of the very good scientific approach is this CPT coding approach, CPT and HICP coding. What happens actually, the point is this: if you can assign, so let me just give an example. For example, the doctor is billing 44950. Now you cannot bill appendicectomy. You cannot say that I have performed appendicectomy. You have to bill this code 44950. Now if I assign a particular rupee, for example, I will pay you 1 lakh rupees for this appendicectomy. So this is a surgical package system. In this way, we can control our cost. There's one of the ways that the government of India should think of how we can implement these type of coding systems in our healthcare system as a whole, our healthcare system. So that's the point. Those are the points I highlighted, although it's nothing to do with homeopathy. So that's why I first started with some of my suggestions of the books which I have shared. I will share these books also in the group. Interested people can go through those. And that's all. Thank you so much. If anybody have any question, you can get back to me in WhatsApp group.
So thank you, Dr. Prasanna Bera, about a good knowledge and a new career system for any medical faculties. And it can be transformed into medical coding. But I thank you as because you are also joined as a medical coder and as a medical profession with teachings in Backson Homeopathic College, and very nice. And you are also showing some books of regarding my teacher, Professor Dr. S.P. Day and Dr. Dilip Bhattacharya. They are very close to me, Dr. Bhattacharya, and my professor, late Dr. S.P. Day. So it is a very new things which is delivered by you, that is medical coding and its opportunities. So if anything understanding and it can show any question regarding this, and I think it may be in future there will be, it is also related with homeopathic treatment also. It may be because we are treating for a long time for a chronic disease like that. So definitely it should be a cost effective method where the medical coding is again required for also to us. So thank you, Dr. Prasanna Bera. Now I can I am calling the second session, that is the our next seminar is understanding the fatty liver disease and its homeopathic management by Dr. Amit Pandey, who is the HOD of Homeopathic Department of Vivekanand Polyclinic and Institute of Medical Sciences, Lucknow. I just want to tell some little things because this disease is nowadays very much developed in all the countries, developing countries, including India, because the changes of our lifestyle and the changes of our diet and regimen is a major cause of that disease. And I just called Dr. Pandey to start his seminar. And okay, welcome, Dr. Pandey. We just start your topics now.
Good evening, sir. Myself, Dr. Amit Pandey, BHMS 19 Class Nice Kolkata. Currently, I am working as a medical officer and HOD department with Vivekanand Polyclinic and Institute of Medical Sciences. Today, I present because here are all my seniors, and I think I am the most junior in the CME. So definitely there is some mistake with me. For that, I first say to sorry if there is any mistake. My topic is understanding the fatty liver diseases and its homeopathy. So without already there is too much left. So now I start. First of all, we have to know what is the liver. I think everyone know what is the liver. As a medical man, the liver is the largest gland in human body. It is also mid gland and exocrine and endocrine. Exocrine function is excreting bile and endocrine function is secreting. The liver is located in the right upper abdomen below the rib cage, shape, base shape. Liver weight is different in male and female. In case of male, the weight is 1.4 to 1.6 kg, and in case of female, the weight is 1.4 kg. Function of the liver. The liver is very important for digestion, for producing bile, and it is also very important for detoxifying our body. So definitely, the liver is a detoxifying organ or system that remove the toxin from our body. Liver does lots of things for the body. It manufactures, it releases, it stores. Metabolic and hepatology aspects of fatty liver. And then how it start, what happened with the liver, all these things I want to discuss here. Whatever you eat, like carbohydrate, fat, proteins, finally it is converted into glucose. Finally it is converted to glucose. You everyone know that glucose is the source of energy which is utilized by the body. Now glucose is from tummy by blood goes to the muscles and liver. In muscles, it is utilized when we move, when we do exercises, when we walk. In liver, it is used for body function. Suppose you are inactive, your muscles are not used, then where will be that glucose go? So it will go back to the liver. Then liver has an additional load of glucose. Now that glucose is not used, not needed by the liver. So it will keep on changing from glucose to fat. And that fat is stored in the liver. And again, you start having fat in the liver. It can actually spill out into our blood and will have high triglyceride, high cholesterol. Now the fat is in the liver, which is less than 5% of the weight. The 5% of that could be fat. If it exceeds 10%, it means there is a fat which is not accepted by liver or our body. And this fat will spill over everywhere and is source of putting body into inflammation. The fatty liver is additional fat into your liver. How common it is? As such as today, due to lifestyles, fatty liver patients are so many. Now you go out onto the street and see 1 in 3 obese in India. 1/3 of Indians today, anywhere in the world, have fatty liver. Types of fatty liver, two types. Number one, non-alcoholic fatty liver, also called as alcoholic steatohepatitis, NAS. Can be two types, simple fatty liver or steatosis or steatohepatitis. Then other type is alcoholic fatty liver disease, also called as alcoholic steatohepatitis as. What is alcoholic fatty liver disease? Alcohol is a major reason for cause of liver injury, and fatty liver is still the one of the most common cause in our society. What is non-alcoholic fatty liver? For a doctor or a clinician, it is almost very impossible to differentiate between the two. Because if you don't know the history of the patient, that she or he take the alcohol, then we say it alcoholic, or I will call it like as alcoholic steatohepatitis. Or if it is non-alcoholic, that is it is called NAS. Why should we worry about fatty liver? What can happen if we ignore it? If glucose is to be used inside the liver, insulin has to go into the liver cell. The amount of insulin that is needed to go inside, that amount will gradually increase. If there is fat in the liver cell, if the fat content goes up to 10% instead of 5%, 5% is safe. If it is more than 5%, then it goes up to 10%, then you need more insulin. If the fat content goes from 10 to 20%, again and again you need more insulin. So every day you will need more and more insulin to do the same work, which is done by the small amount of insulin. And if you require every day more and more insulin, finally your pancreas might give up. And you say you have exhausted, or your pancreas exhausted. Now you have developed diabetes. So it is like a chicken egg story. What comes first? All of you believe that the first thing which comes inside in the liver. This could be genetic, this could be environmental, this could be many more. Now, the second part of insulin resistance is in your muscles. To make your insulin resistance, you have to move. So the first thing is insulin resistance is beginning of fatty liver, and it is the beginning of rest of the body. What is the natural history after you get fat in the liver? If your liver become fatty, then what is the its effect? The liver fat give the fat to the other organ of the body. For example, arteries where it get and blood pressure become heart, you get cardiac event, many more. In case of pancreas, you become again fatty. Diabetes is one of the outcomes. In case you may get polycystic ovarian syndrome. Snoring is one of the most important. All these are associated with fat in liver. What happens to the liver once this process of killing the liver having cell with extra fat? This is called as necrosis or hepatitis, and this is steato, which means fat, hepatitis, which means fat induced hepatitis. So as this cell will die due to extra fat, you have high SGPT, high ALT, which is the marker of the liver injury. Similarly, liver injury These cells have to be repaired. That wound healing is by scar formation. Slowly, slowly, your liver gets each scar. You call it fibrosis. And there are several stages, 1 to 4 stages. Become over extra and you get cirrhosis, which is hard, shrunken, nodular, and non-functional, which is bad liver. Now, the liver also want to regenerate because you can't live with a bad liver. The body will try to regenerate. Sometimes this regeneration is helpful, but sometimes it can cause tumor. So the natural history, the journey of extra fat in the liver is about 1 in 10 and it can become 20 if you have a family history. So what will happen? First extra fat, then hepatitis, then fibrosis, then cirrhosis, and in some cases, then liver cancer. It is less, 3 to 10% chance. Don't let your liver become scarred, sunken, dysfunctional, and useless. Then your whole body is difficult and outcome are not good. So it will reach the last stage, risk factor. Number one, if you have family history, your mother, your father, your brother, your sister with diabetes, blood sugar, cancer, heart attack, brain stroke, chronic kidney diseases, history of snoring, gallbladder stone, PCOD in mother or sister. Then you are in the family where there are genes which are obesity and fatty liver. So you are at high risk. It is the number one. This is the effect of gene and less of environment. Number two, if you have a lifestyle which is different to you, you are the first guy, mother, father are healthy. You can be overweight, but still you can survive. If you are the first person in your family who has become overweight, diabetic, fatty liver, your children and grandchildren will suffer. The third thing is your plate, your food habit. What type of plate do you use? How big the food plate? When do you eat? What do you eat? Will determine because what you eat is not eaten by you but by your gut bacteria. This factor is overweight, very high risk. Most common clinical feature malnutrition, weight loss, ascites, edema, hematomegaly, esophageal varices, hepatomegaly, followed by atrophy in advanced stages. In case of male, some peculiar symptoms are like gynecomastia, testicular atrophy, impotency. In case of female, breast atrophy, amenorrhea, menorrhagia, portal hypertension, splenomegaly, prominent collateral on the abdomen, variceal bleeding, Peter hepaticus, hepatic encephalopathy, circulatory changes, spider telangiectasia, palmar erythema, cyanosis, jaundice, endocrine changes, loss of libido, hair loss, hemorrhagic tendency, e.g. bruising, purpura, dystaxis. Other features are pigmentation, distal clubbing, low-grade fever. Investigation. Here are some investigation. Number one is liver function test, ultrasound USC, fibroscan or FIB scan, elastography. FIB score is one of the most popular to diagnose the cirrhosis or fibrosis. Here, four criteria is used: age, AST, ALT, and platelet. You put it onto the internet and you get an score. If the number is less than one third, 1.3, that means there are less chance of the patient having advanced fibrosis. Nothing to do that time or later. If the number is more than 1.3, you can go second step is the most commonly we do FIB scan or fibro scan. If the number is less than 8 kilopascals, we keep the patient nothing to worry about. From 8 to 12, it is a high risk group. Refer to a specialist. More than 12, chance of having cirrhosis are very, very high. Should go for evaluation and for cirrhosis. That made very important point. Principles of management of non-alcoholic fatty liver disease. There are three types of people. Number one, fatty liver but no disease. It can be two types: normal weight and overweight. Normal weight, such people need extra effort and drugs. Number two, fatty liver and a disease. It is known that the people are brought down to 600 to 8 kilograms. The liver fibrosis replaces the patient. Diabetes even can go away, hypothyroid can go away, liver become less full and it start regenerating. Our aim is to reverse it or reversal. Number three, fatty liver with complication like bleeding or fluid in the abdomen or cancer. Such cases is seen by specialists. Please do not rely on medicine. Medicine is not the first line of treatment. Treatment is lifestyle, which is exercise and diet. My suggestion is an exercise and reduction of BMI. If you do exercise for 15 to 30 minutes, minimum exercise in a day, it is better if you do 45 minutes with sweating, then it's good. For diet management, you can take walnut, you can use turmeric also, and you can use omega 3 fatty acids. As per homeopathic part, miasmatic characters are some. Number one, psychotic, in case of chronic hepatitis, hepatomegaly, one tubercular miasm, esophageal varices, syphilitic miasm, atrophy of liver, metabolic failure. Homeopathic medicine. There are few medicines but with few indication, lachesis, lycopodium, natrum sulph, arduous, chelidonium, phosphorus, and many more, as per constitutional and sign and symptom. Thank you. Now I conclude my session.
So, thank you, Dr. Amit Pandey, for giving a good lecture and the understanding about the fatty liver disease, which is nowadays a very much prevalence, not only in India but all over the world, because we are at present at the era of work from home. After the COVID situation, the total scenario of the world are totally changed as because we are very much accustomed with work from home and the lifestyle is totally changed nowadays and persons are not going outside due to fear phobia of disease like COVID. So this change of lifestyle is now the prevalence of that type of disease is more. And for everyone's knowing, in our modern medicine, the Apollo Hospital started a clinic, namely as Fatty Liver Clinic in Kolkata, and there try to understand how many peoples are the prone for fatty liver disease, and basically these are all asymptomatic. Some few are symptomatic, and as because Dr. Pandey is told in his seminar topics, so these asymptomatic people, if we start treatment and management with their diet and regimen and a good exercise, which is the best regimen before starting the treatment. So it will be helpful everyone just to recover the disease. And I think from homeopathic point of view, this disease is not a single disease, but it is a constitutional disease or it is chronic in nature. It is not accustomed, not acute. It is chronic in nature. So, according as we are treating the other disease by making a proper case history taking or case taking, we also starts the taking the sign and symptoms from all the disease, including the fatty liver and its sign and symptoms and complication, and then select according to the symptoms. It will be better for management and treatment from homeopathic point of view. And this disease, it can be treated very nicely with lots of homeopathic medicine. And if you see the modern repertory, like Dr. Robin Murphy's homeopathic medical repertory, lots of medicine for the disease, that is the fatty degeneration. In the chapter of disease, the fatty degeneration, not only in liver, but also heart, but also pancreas, in many organs where the fatty degeneration is a degenerative disease, the end result of the disease, the degeneration. So lots of medicine is there in every point. Even you can see the fatty degeneration of liver, lots of medicine. The first medicine here is a phosphorus. So I just tell everyone regarding the treatment pattern, and very nicely we can easily treat this fatty liver with homeopathic point of view very nicely. So I think anyone have any question regarding the two subjects, not only fatty liver, but the medical coding, the viewer can call the question and I just see the question answer program next. Okay, thank you here and we go to the organizer Dr. Bidyut and Dr. Kalyani sir.
Thank you so much, all the speakers tonight. But now we want to learn a lot from Kalyani sir. So far, Ranjan sir, in the live chat there are no questions. However, uh, let's request Dr. Kalyani sir to give your inputs, please.
Uh, Thank you, Bidyut. Many, many thanks. And we are really grateful, thankful to our inaugurator of the day, Bendangtula Jamin, for joining with us from such a distance, Kohima. Thank you, madam. And we are really encouraged by your presence. And we are really thankful to Professor Dr. Rajan Tosh for coming with us and encouraging us, sharing his own experiences, views. Many thanks to our brilliant speakers, Dr. Prasanna Bera, Dr. Amit Pandey, for giving a beautiful description and information, especially for Dr. Bera. We are thankful because he has given a new line. During our time when we are students, many people used to practice homeopathy in the evening. Why? Because they had one job, either government or private. Usually they complete their jobs after 5, come back to home, and after 6:30 or 7 they start homeopathic practice till late night. Many doctors I have seen, they are service holders, but practicing homeopathy with full confidence and number of patients. This was the beginning history of homeopathic development. Primarily, homeopathic system of medicine did not have any careers as service, as Dr. Bera was telling. Nowadays, we are starting for careers, services, etc., remuneration, but it was not during our time. You'll be astonished to know when we are getting 400 rupees dependent stipend, we are feeling ourselves as a king. 400 rupees per month. I'm talking about 1980 only. And there was no job. None of us had any ambition to get one job. Only the first director of NIT, Dr. K.P. Mojumdar, he started putting dreams on the students that this institute has been made to create teachers. It is my responsibility to make you teachers and for jobs, but it is your responsibility to complete competently deep NIH, getting good marks. And you'll be surprised, nowadays it is unbelievable. He used to go to ministry and to tell the ministry that I want this. I want that all of my sons, all of my children must get attached with services, either in teaching or any other else. That you have to help a lot. Then only I am ready to serve. Because you might be knowing many of you who are from first batch, especially first and second batch. Dr. K.P. Mojumdar, leaving his good practice in Mumbai, he joined as a director of NIH just to create teachers in National Institute of Homeopathy. So his was a great dream that all the NIH students will be a teacher with payments, good payments, with good order, good status. This was his dream. And definitely the dream has been successful to some extent by getting services in teaching, research, and many other fields, medical officers, and gradually the scopes will increase because craving for homeopathy is increasing in India. Whatever may be the problems among ourselves or anywhere, but population is demanding homeopathy day by day. Gradually it is increasing. So of course, scope of service must increase. But there is another one thing. During our time, I am telling you one more thing. Anybody, any doctor, even allopathic doctors, if he is to tell somebody that I am serving, I am in a service, then he is neglected, rather he is defamed. Yeah, doctors is service, giving service, living practice. Means doctors are in service is not a creditable affair during our other life. Doctors mean he will see the patients and patients only. But the picture and scenario has changed. Nowadays, all of us are progressing. Especially, I am telling those who loves homeopathy, exactly like Dr. Bera, what he's trying to do, establish yourself. Bread and butter is definitely, of course, needed, but do not leave homeopathy, because we are born by homeopathy. We love homeopathy. As much as you can, keep homeopathy in contact, practice, plus whatever you like. There are many successful students and average students too. They are not only doing homeopathy practice, but also doing some other things. But the thing is that one more beautiful line we have seen, and flourishing line, medical coding. Of course, this will gradually grow up. Many of us can definitely join, and many of us has already joined in other services too, like hospital management and others. So this is very much encouraging information from him regarding the flourishing line of medical coding. Special thanks to our second speaker today, fatty liver. As Dr. Tosh was telling, day by day this is increasing, not only increasing, it will go on increasing, because we are becoming gradually lazy. We want our food just before the lips without any exertion, any pain. And businessmen, they are providing us those type of foods by preservatives, by different means, and different type of toxins as preservatives, colors, and other means they are getting into our body as food. And all of us are very aware that liver is a organ which is supposed to drain out all the unnecessary toxic substances from the body. So if we go on developing this habit of modern diet habits, modern lifestyle, alcoholic habits, and other bad habits which is not healthy for the health, ultimately we are weeping the livers. We are making our livers day by day sick. And the most defense mechanism by immunoglobulin system from RE system of medicine, RE system, the liver is the greatest organ of RE system. If we make this liver sick, will be definitely more susceptible to multivarious diseases. The antibody antigen reaction will be weakened, because the main organ to produce antibodies, as we have made them sick by taking irregular diet and irregular lifestyle. So whatever you are doing, whatever you are eating, doing, please remember that your body, especially the liver, is exposed. Liver is taking the strain. Regarding liver, Dr. S.P. This Dr. was mentioning, Dr. Professor S.P. Day, great doctor. I will tell you one of his case. And you know the patient, all of you know the patient. That patient is Dr. Bhavesh Chandra Samanto, B.C. Samanto. You know, he was working in a nice research department. I think you know him. He had some chronic liver disease for years together. And he was under treatment of Dr. S.P. Day. All along, he was given Nectrum salt. When Dr. Day becomes sick, this I heard from Dr. Samanto himself. When Dr. Day became sick gradually in last days of his life, Dr. Samanto one day asked him, "Sir, where I will go when you will not be here? After you, to whom should I go for my chronic treatment of liver disease? I am not getting off it. I am not able to take normal lives too for years together." The reply of his such a great man he is, I cannot but to mention this incident. Dr. S.P.D. instantly lying on the bed told Dr. Samanto that one S.P.D. will go, many numbers of S.P.D. will come up. Don't get worried. He will get many S.P.D. How much confidence he had among his students. So anyway, dear friends, we must pay respect by improving ourselves, not only to fight against the liver disease, but also all sorts of diseases. Especially contribution of Dr. Nosot, practice in treatment by Nosot medicines. S.P.D. was a brilliant scholar, I can tell you. He was a teacher of NH2. Another instance I will tell you, that was one addition to Dr. Bhaveshamant also, when he told me that I am stable but not getting expected improvement, is not able to take normal diets. So immediately one incident came in my mind. That is, one of my brother, cousin brother, he was working in Indian Navy. When there was Pakistan and India war, usually ships used to be on the sea for weeks together, days together, far away from the land. So supply of food, medicines are not available. And at that time, due to artificial foods and artificial things are supplied to the sailors, they become sick, liver becomes sick. So that time I heard from my brother that any liver disease, recorded or known, will be put to a room, he'll be provided only water, lemon and glucose. That is their food, that is their drinks. No other things will be given until patient becomes normal. And many patients he has seen of his own that during war on the sea, during the war voyage, number of patients are given simply lemons. We called in Bengali as kubri, means like a bamboo, what should I say, not cage, like open pots, big pots, about 1 kg, 2 kg lemon that is given to that room, packet of glucose and only water. That I advise Dr. Samanto, you go on taking this experience, go on taking lemons. And from the next day onwards, Dr. Samanto started taking one lemon every day in lunch, used to bring from his home and used to take it in our room. And with Dr. Ishvide's medicine and the lemon, gradually he became normal, and still he is normal, active, living his normal life. So what I want to tell you, probably that chemical substances remaining in the lemon and your we called as shosha, means cucumber. In Hindi it is called khira. You will see, you just put some oil or fat in your fingers, put 2 drops of lemon juice, instantly that will be dissolved. That means insoluble fats become immediately soluble in contact with citrus acid or citrus discharge. Same thing also by cucumber juices. You put some oil or fat in, just take 2 drops or take a piece of cucumber, khira, and rub it. Instantly the insoluble fat will be soluble. Your hands will be clean. So what I have experienced in my life, wherever you find a case of cirrhosis of liver or a critical disease, ask him to avoid fatty food, fishes and meat with fats, and at the same time ask him to continue this lemon and khira as his diet. You can have your experiences. This is my simple experience I am sharing you. I do not know how far scientifically it is true. You can test it and I think you will get good results. Another thing, how to assess the patient is going to suffer from liver disease. Many of the alcoholic patients, they will not disclose. Many of the patients who are having irregular lifestyles and your packed food, they will not easily disclose. Those who are consuming preserved foods, freeze foods, they will not easily disclose to you. Only they will complain. What complaint they will come usually of a liver disease, that is persistent dyspepsia, not getting easily cured. Only by pentapresent group of medicines or antacids or alkaline substances, for the timing they are getting relief, means the acid is becoming alkaline, neutralized, and to some extent for the timing getting relief. But again, daily complaints are coming back. Or he has to develop, you are compelled to develop habit of taking antacid or pentapresent group of drugs or any such type of thing which contains alkaline. So brothers, whenever you get any patient with persistent dyspepsia, whether it is IBS or any type of disease, do never forget to test the liver, LFT or ultrasonography. And if you find a little bit things have started, I usually ask the patient, when he is suffering from persistent dyspepsia, it is more common in West Bengal because of the high humidity and hot and humid atmosphere. What I do usually, I first test the stool, whether there is any parasite or not. then I ask for liver function test. If I get something in liver function disorders, SGOT, GPT, or alkaline phosphatase, I ask for ultrasonography to detect early changes of liver. Because once the liver changes are detected as a disease, means cirrhosis or some other diseases or nausea, vomiting, etc., bleeding, hemoptysis, piles, all the manifestations of primary liver diseases, portal hypertension. It is late and too late. Many times we are not able to cure the patient. The patient ultimately succumbs. So you and your family, yourself, your friends who are having dyspepsia, get the liver tested by liver function test and ultrasonography if necessary. Then you'll be able to early detect, early treatment, because primarily complaints of liver pathology is not easily manifested except dyspepsia. Because you know that acid alkali balance is highly maintained by bile in the gut. So our target will be whether the patient is dyspeptic or not. Moreover, once if you find that patient is getting irritable, short-tempered with dyspeptic disorder, losing temperament easily, not getting proper sleep, means disturbed lifestyle automatically cannot control himself. Definitely you must test liver function and the structure. Anyway, so it is a very brilliant CME, I must tell. Regarding phosphorus, Dr. Tosh was telling, I have tested phosphorus nicely. I found a patient in NIH that is Gilbert syndrome. You know that persistent hyperbilirubinemia, with or without treatment, no changes, without any complaint, is Gilbert syndrome. Ultimately, that will destroy the liver. And fortunately, not that Dr. Tosh told or I have seen the Marquis repertory, but the case becomes phosphorus. He was a very nice artist, looking lean, fair complexion, very fine tasted, hot patient, and I started giving phosphorus. You'll be surprised to know it is a known disease as incurable. Gilbert syndrome is not curable disease that got cured within a very short period by phosphorus. So definitely, if you study boric mathematics and other mathematics, you will find in the paragraph, first paragraph, there is an hint as if the liver is primarily disturbed, then other symptoms are secondarily manifesting. So, of course, phosphorus is a very nice drug. Net terms are after Dr. S.P. Day's experience on Bhavesh Samanto, I tested in different cases of very, very chronic disease for years together, suffering, not getting relief, even in cirrhosis of liver, cancer of liver. I have tested net terms with fantastic results. Of course, there are symptoms. Basic symptoms are what in net terms I can tell you, as you have seen to Dr. Bhavesh Samanto, I have also observed, without much change of the structure. Suffering, not able to eat, but not reducing weight. And more fond of taking hydrogenated foods, means leafy vegetables, the fruits and vegetables containing more water. He used to fond of taking those things than that of non-veggies. Anyway, there are many other symptoms too. So there are fantastic drugs for liver disease, especially fatty liver, where modern system of medicine or conventional system of medicine and other systems are to some extent handicapped unless the supplementary system, supplementary drugs are given, unless some conservative medicines are given, patients do not get relief. And those medicines are given to keep the liver function normal by the conventional medicine react reversely. Those medicines ultimately extra or toxic effects of the medicines, they should be expelled by the liver. So a sick organ is given medicine to make him further sick. And what you see for dyspeptic patients, you might have experienced, all of you are having experienced that dyspeptic patients become restless, anxious, tensed because they are disturbed in their daily activities. Infrequently, they goes on taking this medicine, that powder, those powder because of bowel clearance and others, appetite, this and that. So by taking multifarious type of medicines, whether it is herbal, chemical, or whatever, ultimately they are gradually making the liver further sick. So we must be very, very careful regarding the liver. If your liver is sick, whole body will be lethargic, exhaustive, easily tired, easily exhausted. All of your activities will be your stunted. You won't be able to perform normal function. If your liver is normal, whatever may be your body weight, whatever may be your structure, you'll be fair and fine and very speedy, fast and prompt. You can experience of yourself and among your patients. So to keep the body half strong, effective, active, very active, we must take maximum attention on the liver functions. So thank you very much. Thanks to all participants, all viewers, those who will view it later on. And we are really thankful for coming with us, sharing your experiences. In future, we must expect that you will come forward by your further experiences to share with us. We will learn from you.
So there is
All of will grow. Thank you very much.
so there is one question, sir, from Probir Mujumdar. Orko, please highlight the question. I had given
For
it
me,
to Amit and Ranjanda on
okay.
their WhatsApp. What is the role of worms, different modern allopathic remedies in fatty liver, including liver cirrhosis? I repeat the question. What is the role of worms, modern allopathic remedies in fatty liver, including liver cirrhosis? This question is for Dr. Amit and or moderator, sir, Dr. Ranjan Tosh. Amit, I think you are muted. Please unmute yourself. Amit, we can't hear you. Orko, please help Amit.
Ah,
Now
right,
Yes.
it's
right.
as I previously told that medicine is not the first line of treatment. Treatment is lifestyle and which is exercise and diet. As sir also told, in this case, I think as per totality of symptoms, we provide the medicine. First, we kill the worm, and after that, the treatment.
Ranjan sir, can you add something more? Because the question was, what is the role of worms, different modern allopathic remedies? Over to you, Ranjan sir.
Okay. So, first of all, you just try to understand the different modern allopathic remedies. So, allopathic remedies are different from homeopathic remedies first. So, allopathic remedies are basically the antibiotics, the steroids, and non-steroid anti-inflammatory drugs, and the drugs like purgatives, analgesics, and painkillers. So these are the types of drugs which are used in modern allopathic treatment. So that is their basic things for modern treatment. And lastly, the chemotherapeutic drugs in malignancy or cancer, like that. So in acute disease, they are controlling very nicely in acute condition with the help of antibiotics, with the help of purgatives, like a person is not regular bowel habits. So they are using the purgatives for regulating the bowel habits. And like any infection, either bacterial or viral, they are using antibiotics for their treatment. And in case of chronic inflammatory disease, basically the modern medicine till now are in helpless condition. They are using the steroids, which is called the immunosuppressive drugs. Steroids are basically immunosuppressive drugs So they are just suppressing our immune symptoms. When a person is ill, basically from the point knowledge of our organon of medicine in homeopathy, so the signs and symptoms are developed, and during case taking we have a strategy or chapter, case with the fully developing symptoms, case with the few symptoms. So these are be done during a proper homeopathic case taking. So case with fully developed symptoms, case with few symptoms, we are treating accordingly the symptomatic. So the modern allopathic medicine, as they are treating very nicely the acute condition, but they have some toxicological effects in our body. So, with the toxicological effects, liver is the only organ where the toxicological effects are drained out. So, during the drain out of toxicological effects of this modern medicine, they are also damaging some cells of the liver. Maybe I don't know whether is my not huge knowledge about this allopathic medical uh, medicine or modern medicine, but I can say there is a basic drugs are hepatotoxics. So I don't know how they are damaging our immune system or liver. So you can have some idea from modern medicine books and information from internet and all others, the effects and side effects of the drugs, where it affects, in which system the drugs is affect, and which system the drugs is side effects or affects our other organs. So this I can say regarding the different modern allopathic medicine, because they are basically all research, the antibiotics, the steroid, the non-steroid inflammatory drugs, the purgatives, the analgesics, the antacids. So all these subgroups of drugs, they have some specific effects on their particular organ. But homeopathy is not at all like this specific organ-like treatment. So we are based on totality of symptoms, and according to the totality of symptoms, Dr. Kalyani given a very nice experience regarding Dr. Day's case, and Dr. Espinosa is also my teacher, and regarding the natural salt and very good effects of phosphorus in liver disease. And we have lots of homeopathic medicine during our treatment, not only phosphorus, lycopodium, natural salt, but lots also carduus marinus, chelidonium, and many others, even nosodes also. Syphilinum is a very good nosodes regarding the jaundice of newborn. I have seen in my one of my cases of my father. He was also a good homeopath, and I have seen he has cured a patient in my student life when I was a school student and I was attached with homeopathic students. I have seen a patient baby with just after delivery, uh, the baby suffered with jaundice, and my father prescribed during that syphilinum 1 ml a single dose, and gradually the jaundice is subsided within 7 or 10 days, and then treated accordingly. So that I can say, I can share my experience with all other spectators, and I think you can see the modern allopathic remedies. Just see the effects of their particular organ and system and see their side effects. If you know this, you can easily understand the effects and side effects of modern allopathic drugs. So thank you. I think you can be maybe
Dr.
satisfied or not, I don't know. But I try to
Dr.
satisfy every leaders or every viewers. Okay?
Dr. Tosh, may I add something? Dr.
Yes,
Tosh,
yes, yes, of course.
so dear brothers, your question was, what was your question? I can give you a little bit information. Have you seen children who are suffering from worm? I am giving
Suffering from?
description. worm infection or infestation. They
Warm,
become
warm. Yes, yes,
worm infection.
yes,
They become emaciated, limbs become emaciated.
yes, yes,
Someone
yes,
develops pot-bellied, abdomen is big, sunken
yes,
eyes,
yes,
ashy face, as if the baby is suffering like seriously, but not been diagnosed. Either eating
yes,
too much or not at all eating anything, complete anorexia.
yes,
Number
yes,
one information, all of you have observed. Number two, have you seen ever the packets of the medicines given for herbicides or worm killing drugs? If you have not seen, you see any packet of any anti-worm diseases, it is written below, should not be taken without the instruction of a physician. But what you
yes,
find, infrequently, abundantly, the children are given anti-worm drugs to kill the worms without testing the stool, without being confirmed from what type of worm he is suffering from.
yes,
The
yes,
fact
yes,
happens ultimately. Primarily, the baby is suffering from the worm, and you know that all the worms had got their external toxin to
yes,
for their good convenient atmosphere of survival. They liberate toxins, and the toxins made the food digested food contains as per their desire. They live comfortably, makes the child or the baby to a gradually very shrunken condition. As we know that Ascaris lumbricoid is the most effective or very serious type of worm which can travel anywhere, can create many diseases in the brain, liver, many other places. That Ascaris lumbricoids liberate ascaron. That ascaron is such type of toxin that starting from the hairs, brain cells, endocrine, liver, there is no organ in the body which cannot be affected by that ascaron, such a strong toxin it is. So just imagine, like Ascaris lubricoid, vermicularius or all other worms has got their own toxins. They are liberating, they are being absorbed by the GI system, they are being circulated to the whole body. For the reason, the liver has become toxic, loss of appetite, loss of normal metabolism, child is becoming emaciated, either eating more to satisfy the worm or not at all having any appetite because the liver is sick. The baby is gradually becoming a worm type of disease, as I told you. But the thing is that what happens by giving the conventional medicine to kill the worms, primarily the patient or the child is suffering from the ascaron or their toxins of the worms. Secondarily, we are putting some other toxins from the external sources to kill the bacteria, to kill the parasites. What happens? As you all know, that all the antibiotics available in the world ultimately and instantly kills all the bacteria floras who are thousands of numbers,
right,
hundreds of
right,
types and crores of numbers. That is why antibiotics must accompany vitamin B complex, because vitamin B complex produced by the bacterial floras. So that been killed by the antibiotic of any form. Similarly, the drugs for ascaris or any other worm infestation, that worm will be killed definitely, but the drug, it is liver who have to neutralize those drugs, who have to expel those drugs from the body. That is another hazardous function of the liver, who is already sick by the toxins of the worm. So by giving those medicines, liver is doubly becoming sick. One for the toxins of the worms, secondarily from the drug. So only when the case is very serious, going to be fatal, test the stool, confirm the worm, assess the amount of drugs necessary for the baby as per his body weight and the contents of the stool, means number of parasites or eggs found in the stool. That should be assessed, but is not being done nowadays. So infrequent taking of anti-helminthic drugs or anti-worm drugs are very dangerous. And will many packets you will see that very cautiously must be taken, because it ultimately affects the retina, cornea, especially cornea, to make corneal opacity. So most of the worm drugs in conventional system medicine has the property to opaque the cornea. Majority of the corneal transplanted cases having the history of taking worm drugs for a lengthy period. There are many patients ignorantly or under the control of a less educated doctor, infrequently they are taking warm drugs. That is very, very dangerous. So definitely we must be very, very cautious to introduce conventional or chemical materials to kill the worms. Not only that, the drugs kills the worms, definitely. But the drugs can never develop immune system by which those worms will never grow in the gut. Only killing is their function, not giving any defense mechanism, not having the property to tone up the liver to liberate such type of antibodies or enzymes from the GI endocrine system or from any other endocrine gland by which those worms will not be able to survive anymore. Even he is reinfected. What homeopathy can do. Homeopathy doesn't care about the worm. Homeopathy doesn't care about the your toxins of the bacteria, toxin of the worms, but it gives the medicine. Simultaneously, it will tone up the liver. Simultaneously, gut will create such a situation, atmosphere where worms will not be able to survive. You might have seen by giving homeopathy medicine, worm is coming out through stool, worm is coming out through vomitus, worms, big ascaris lumbricus are coming out through noses during sleep. I've seen it, I've experienced it. About 1 feet of worms is coming out from the nose while baby is sleeping. Family members are shouting, what? Some snakes are coming inside the neck as if the baby is under ghost, effect of ghost. So such type of serious worms cannot be casually dealt with to make the sick, to make the liver sick. This is all, Dr. Tosh. Thank you very much for giving the chance.
Okay.
Thank you, sir. Thank you. Excellent. And this is the purpose of our CME. It's a group discussion like the speakers used to share their views. After that, our moderator, Dr. Kalyani sir, and all the other some days, Pralay, Dr. Pralay Sharma, the hospital super, and many other hosts, whoever are hosting this session. Now, I request through this live session tonight that all the alumnus across the globe, we will be having our alumni meet on 9th of December 2022 at Kolkata. The venue will be finalized once we get the permission from our director and our beloved hospital super, Dr. Pralay Sharma, our IPD in charge, Dr. Trideep Sarkar, those who are working day in, day out for the development of the patient care and as well as for NIH hospital. They are also looking after the alumni along with Om Prakash, Dr. Madam Om Priya, Dr. Sapan Pal, and many more, those who are in with NIH. So we like to see all of you come back to your alma mater and join us on 9th of December. The early bird offer was rupees 1,000 as a contribution amount for the alumni meet, and that was up to 31st of August. But it's on your demand. It's a decision by the alumnus who were present in the last eighth preparatory meeting in Zoom. They had decided to extend it up to 20th of September. So today is 11th, another 9 days left to join the alumni meet. Regarding the accommodation and others, we are going on with the modalities and we have very lot of important projects to do during this alumni meet. A very big platform will be launched during the alumni meet, that is a e-journal being coordinated by Dr. Chandrasekhar Pore and Dr. Mohammed Naim. Our editor-in-chief is our beloved sir, Dr. Aishwarya Das, being backed up by the eminent personalities like Dr. Professor Chaturbuja Nayak sir, Dr. Mohanty, being advisory board in the Dr. S.K. Bhattacharya, Dr. Sanirmal Sarkar, in the editorial board, Dr. S.Z. Khan, Dr. Mahapatra, and many more names, many more seniors and juniors to bring a larger platform for learning through e-journal. So never hesitate to share your experience during your stay in NIH, relating to the history of NIH, relating to the history of homeopathy in India. in the world. Even the recent discussion, the pondering views to be discussed in length and breadth about the inclusion of inclusion of modern pharmacology in the final year in BHMS course. There are a lot of pros and cons. So this brainstorming sessions can be on the e-journal. We have our WhatsApp group. A brainstorming session was there for last almost 26 hours, being initiated by Professor Rajat Chattopadhyay, then Dr. M.K. Tyagi sir, Chandrasekhar Pore, Dhanalakshmi, and many more eminent juniors, seniors. All the alumni are pouring in their thoughts. Now, once we'll come and open with the e-journal in a platform, you will have a larger platform to share and exchange your views in tandem. This CME will continue as it is, but that will be a very bigger platform, exchange of views of the with the scientific world, develop certain plans along with a blend of social interactions. Obviously, it's not all those database. It will not be copy paste like of research papers, but will be a lot of things with an open heart. Like today, our beloved Kalyani sir had said, he had really attributed and congratulated Dr. Prasanna because the way he presented his case and himself, it's something awesome. I was after I passed my BHMS and completed my internship, I had joined a marketing company. I joined a marketing company, a very reputed pharmaceutical company, and created a lot of job opportunities for these homeopathic doctors through the marketing setup. Now, several homeopathic manufacturers are there who are recruiting doctors. The time I joined over there, a lot of seniors, lot of young and old homeopaths said that, will you be the EMA? I told, I am in a vision to create something new. I didn't like the job. I didn't enjoy the profession as such. Post 2006, I quit it. I am back in the profession of homeopathic as a physician. But so there are several opportunities. We have so many alumni across the globe who are in the insurance sector. They used to speak to me, to Praloy, to many other alumnus. They used to interact. They are feeling shy. My beloved brothers and sisters who are in the insurance sector, please come up and speak yourself, speak your profession up in the CME. How it can be as a backup. There are a lot of people who are in the health industry. They're in the Apollo, they're in the Deshun Hospital, they're in various chain of hospitals. We have several alumni who are in even in this coding. What Prasanna had told today, one of them, I am not mentioning the name without his permission. He is one of them in the. He's being now a vice president in one of the reputed coding company and best at relocated in Mumbai now. So there are a lot of opportunities. Never hesitate to share your job, means your profile and the way what you learned from NIH and what you are doing now and what is your feeling. It's up to the profession to choose, up to the students, those who are going to be the homeopaths in future, what they want to choose. It's up to them. So we like everyone's input. We are open to all. We are not means restricting anybody. All the alumni across the globe, please come forward and join hands. We want to meet you all. Want to see you all live on 9th of December. On 9th of December at Kolkata. And with permission of our respected Kalyani sir and all the speakers, moderator, my beloved Atula, uh, we are returning back to our backstage editor, Orko.
Thank you so much, everyone,
Thank you.
for the
Many thanks.
encouragement.
Many thanks.
Thank you.
Many thanks. Please come again.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. For watching live and were watched as a recorded version. So again, as you have heard the news that it has been announced that alumni meet will be coming soon, and I am not going on that topic for now. So let us just first discuss on the IT matters for which I came at the end. So basically, we are facing some IT issues like many of our uh, team members are having their exams, their VHMS exams, for which we are unable to process. But the rest of the crew who are working die hardly on the back are just doing their work. But let me just tell you this that we thought of means introducing to you the feedback form of the CMEs, but sadly we have to postpone the plan till the end of September or at the beginning of November, sorry, at the beginning of October after pujas. So can't say about that for now. It's being delayed the feedback form, and with the other things which is related, I am getting some complaints like related with the certificate part. So let me tell you with that the last three CMEs the certificates weren't issued because the server was down. Let me tell you about that. The server was down because we did it on purpose as we had few members to take the control over that part, and many of them were busy revising the syllabus for their exam. So that's why we had to close that server for now. And I hope after from the next CME you will be getting new updates and also the some modification on the old ones. And also again with the Spotify thing, let me just tell you, we just open up a Spotify platform, a Spotify playlist. The link is in the description. In this Spotify playlist you can just go and listen to the highlights of previous CMEs. Just follow that, and we are trying to upload on every Sundays, but sadly last 2 or 3 Sundays we were unable to upload, or more than that we were unable to upload due to the poor means lack of editing people as they were giving exams, and lack of rearranging the audio thing. So that's why it's sad to just say that we weren't able to upload, but we give you our deepest promise that we will upload other CMEs, other CME highlights as soon as possible, and every Sundays. After, I guess after 22nd, we all our IT team will be ready for these updates. So with this, this is all the updates. And finally, please like this video, share this to your fellow homeopaths, and also uh, homeopaths and students, and also follow us on Instagram and Twitter for updates. Join our Telegram channel, means YouTube Telegram channel, where you will be getting regular updates on what is happening on NIH, and also what is happening at NIH alumni and NIH, and what is happening means whenever we schedule next CMEs, you will be getting updates from there too. And also join from there, you will be getting updates on the quiz group part, joining quiz group. So we will be getting more updates on Telegram. And do like us on Facebook. We have a Facebook page. All these links are given in the description below. Just go click over there, follow us, like us, and share. With your help, we can grow. And please help us to grow more on YouTube platform. So with this, thank you. And for now, the panel members who are waiting on the backstage, please wait for few more seconds because we will be having post CME talks. So good night, all the viewers. See you on our next CME. Till then, it's me, Medico Orko Mukherjee, cutting off.